Bonjour, everyone. Welcome to my YouTube channel. I will carry on from the last lecture and will focus on percussion and auscultatory findings. Percussion findings in respiratory examination can be normal or abnormal. Normal sounds are resonant or tympani. Abnormal sounds come from being hyperresonant and dullness. Hyperresonant is found in emphysema or pneumothorax. Dullness is found in pneumonia, atelectasis, tumor, and pleural effusion. Auscultatory findings can also be normal or abnormal. Bronchial, bronchiovesicular, and vesicular are normal sounds, and abnormal sounds like crackles, wheeze, rhonchi, stridor can occur. Crackles are found in pulmonary fibrosis, bronchiectasis, and atelectasis. Wheeze is found in asthma or COPD. Rhonchi is found in bronchitis, pneumonia, COPD, cystic fibrosis, bronchiectasis. Stridor is found in laryngomalacia, croup, foreign body aspiration, epiglottis, vocal cord paralysis, anaphylaxis, post-extubation, laryngeal edema. Take loads of care and keep all the sick patients in your prayers.